Okay, hi, my name's Haley Stark, and I'm doing the histoplasmosis presentation with Kylie Morden. She took care of part one of the presentation, so I'm just going to hop on and do part two, and I'll just skip right to the symptoms. So for some people who are exposed to histoplasmosis, they do not have any symptoms at all, whereas other people will start to show flu-like symptoms that can go away on their own. And with that, it's just the mild flu symptoms that I'll go into a little bit more in depth on the next slide. And with these symptoms, they'll usually start to appear anywhere from 3 to 17 days after exposure or when the spores are inhaled. And then people who get the symptoms will usually see them disappear anywhere from weeks to months, although some symptoms will last longer if the infection is severe. And then people with weak immune systems can develop a long-term lung infection. And then, to go into the symptoms a little more in depth, the flu-like symptoms are fever, cough, fatigue, chills, headache, chest pain, body aches. So really any symptoms that you see with the typical flu. I'm sure we've all had that at some point. And then for diagnosis, you can take a chest x-ray. You can do a CT scan of the chest. You can collect samples of fluid from the respiratory tract, or you can also tissue biopsy the affected tissue. And then with that, they will take that sample and they will use it to examine whether or not a culture of histoplasma is grown from body fluids or tissues. And that's what this image in the corner of this page is showing. And we've done a little bit of this in microbiology, just kind of isolating, but you can see the growth in one more than the other. So for treatments, like I said earlier, it can go away without treatment. However, with disseminated histoplasmosis in the lungs or chronic histoplasmosis or infections that have spread from the lungs to other parts of the body, you can use a stronger antifungal called itricnizole. This treatment can take anywhere from 3 months to 1 year, depending on severity and immune status of the individual. Okay, in the at-risk population, individuals with a weakened immune system, as I've said multiple times before throughout this presentation, I've mentioned that, and then infants who don't have a fully developed immune system, obviously, and then adults 55 and older who typically have a compromised immune system, going along with age. And then lastly, prevention. You should avoid areas or activities in the environments where histoplasma is present, such as materials containing bird or bat droppings. That's like old tree stumps out in the yard or, anything along those lines. And then obviously chicken coops, because those contain bird droppings. And then caves tend to have bat droppings. And then cleaning and remodeling of old buildings. I think both old bird droppings or bat droppings can be found there just in, but yeah, those are places to avoid, and I think that's all I've got for you here. And there's our references. Thank you.